Smartphones are essentially pocket-sized computers capable of executing many complicated programs, from video games to navigation aids. Attachments called dongles further extend those capabilities. Scientists at New York's Columbia University have developed a lab-on-the-chip that, when plugged into the phone's jack, turns a smartphone into a tool for diagnosing infectious diseases such as HIV and syphilis. Sam Sia is Associate Professor of Biomedical Engineering at New York's Columbia University. He says early diagnosis may be a matter of life and death to patients such as pregnant women in rural parts of Africa.
By providing accessible diagnostics to these patients, they can get treated and their babies can actually be born and thrive and live. So it's really a matter of life and death if they don't have these diagnostics.
For 10 years, Sia and his team worked to develop the attachment they say can perform nearly as well as $18,000 laboratory equipment.
Instead of doing a blood draw, getting that sample sent to a lab, you can actually do it on the spot with just a finger prick of blood, and you get the result in 15 minutes with very similar quality as doing the test in a lab.
A small-scale testing of patients in Rwanda provided highly accurate results. Sensitivity in finding the target antibodies was 92 to 100%, while ruling out the people not infected was 79 to 100% on the target. Sia says the capabilities of the lab-on-the-chip attachments are not limited to sexually transmitted diseases or STDs such as HIV and syphilis.
We can certainly look at other STDs such as hepatitis and herpes and so forth, as well as other infectious diseases, including malaria and so forth, but also chronic diseases.
Sia and his team are now preparing a larger-scale clinical trial required for approval of the device by the World Health Organization. George Putic, VOA News, Washington.